Hello and welcome back to another episode of Medicine in Small Doses. I'm your host, Uju, and of course we're joined again today by Dr. Amobi. This episode starts off with we're continuing the discussion on prostate cancer. And if you want to listen to the first installment, please do so, as this is a part 2 and we're picking up exactly where we left off, where we were talking about PSA testing with Dr. Amobi. And we're going to continue that conversation right now. Dr. Amobi, when I was preparing for this topic, as you were aware, for example, as women, we get letters here in the UK from about the age of 25 for things such as, a smear test, which will obviously screen for the chances of someone, or a woman rather, getting cervical cancer. So I looked up to see if there was a similar thing for prostate cancer, for men. And the National Health Service in the UK recognizes the benefits and limitations of PSA testing. This is the information I found. The NHS does not have a national screening program for prostate cancer using PSA tests due to the potential risk of overdiagnosis and overtreatment. Instead, the National Health Service encourages informed decision-making and individualized discussions between patients and healthcare professionals regarding the benefits and risks of PSA testing based on personal circumstances and preferences. So, I may, if I may ask about PSA, and not always accurate, that is very, it's quite interesting, the reasoning, I guess.
Yeah.
Can you elaborate on that?
Yeah, I think I mentioned this in the last episode in terms of, risk of false positives, which is picking up, people who do not have cancer, and then the blood test, is high as a consequence of, other forms of cancers that can cause other things that can cause high PSA that is not cancer. Mm-hmm. So, or false negatives where people have normal PSAs, despite the fact that they actually do have prostate cancer. So I think that circles back to, what you indicated here, the NHS said about overdiagnosing and over-treating. So it's, at the moment, we still haven't have the most robust, accurate way of establishing, prostate cancer from that perspective. Even just to go slightly further is that research shows that if you get 4 men now who have high PSA, 3 out of them with high PSA may not even have prostate cancer, right? And approximately 1 out of 7 men with prostate cancer can have normal PSA level. So it's still an area that there's still a lot of focus in terms of research to see if we can, do better in diagnosing prostate cancer, because it's tremendously important. 1 in 8 men, and of course in our community, 1 in 4. So there's usually some reference levels, so if you age 50, between 50 and 69, a PSA level of 3 or higher is considered elevated. So of course in those instances, then you get referred to specialists to have a look. But I think the most important takeaway information around the PSA is to remember that prostate cancer does not or may not cause any symptoms at all. And without testing, it could go undetected. And B is, if you're black, it may present way earlier. Mm-hmm. So whereas other races may have the luxury of, I wouldn't say luxury, but it comes to a later age compared to us. Mm-hmm. So the utility of tests cannot be understated. We're going to have a talk about it and have a chat. And every time there's a new information, there's a new studies, a new thing that's coming up to improve that service. So don't get left out, and knowledge. Exactly. Yeah.
Brilliant. Okay. Thank you. Right. Okay. So now we're going to kind of switch the focus on how we can best, help people that might be susceptible to prostate using lifestyle medicine. Again, lifestyle medicine can't be understated, as we've always said in these topics, but in what area does lifestyle modifications, can that help?
So let's start with the foundation of our health as we get to know it today, sleep. In my estimation, number one in overall health, or arguably top three. So now you may want to ask, what has your sleep got to do with your prostate? And the answer is a lot more than you can imagine. You see, one of the important things that we learned, I think about 10, 15 years ago, was that the level of your melatonin can affect your prostate health. Now, you may want to ask, what is melatonin? Melatonin is a hormone that is released by your brain towards evening time in readiness to get you to sleep. So when the darkness starts coming, your body starts producing a lot more of melatonin. So we know that optimal sleep is anything between 7 hours to 9 hours. So they did some studies in Iceland, and then they had a look at over 930 men, and then they followed them up for 7 years. And what they found was that men who have higher levels of melatonin in the urine had an astonishing 75% decrease the risk of advanced prostate cancer compared to men who have lower melatonin levels. So what that means in English is that you need sleep. Your aim should be between 7 to 9 hours every night. We do understand there are some other factors like shift work that can affect your sleep pattern, and it's very important that you have a chat with your doctor to establish how best you be able to navigate that, because it's very important that you take your sleep seriously, and there's always a solution for something, and it's very important that you have a chat with your doctor, like I said. Thank you.
Thank you, Doctor. Okay, now, so let's shift gears to exercise. Can you tell us how physical activity ties into prostate health?
Absolutely. Physical activity, as far as I'm concerned, is a game changer when it comes to prostate health. This is because various studies have shown that men with prostate cancer, so these are people who already have prostate cancer, who engage in regular activities or regular exercises, tend to live longer than those people who have prostate cancer who do not engage in any activities at all. So we know that even a modest amount of moderate or vigorous exercises can have remarkable benefits. See, the issue here is we know that obesity is the second most likely cause of most cancers after smoking. So this is where physical activity becomes very important. And you may want to ask, okay, so what exactly should I do? Now, there are two types of exercises. That's what we call aerobic exercise, and the other one we call anaerobic exercise. Aerobic exercise involves using more oxygen. So example for that, it would be exercise that includes walking, swimming, jogging, and cycling, because it keeps your heart healthy by increasing your heart rate and your breathing. Whereas anaerobic exercises are those ones that involve quite like, you to have a burst of energy, things like, weightlifting, yoga, and things like that. Whichever one that you use is great. But what the evidence shows is a combination of both will be tremendously useful for you. So I think it's quite difficult to have like a study on whether exercise itself prevents prostate cancer. But we know that exercise and reducing weight reduces your risk of cancer tremendously. So if you already have had prostate cancer, the evidence is overwhelming that any exercise, no matter how modest it is, all right? So moderate exercise means that you need to, you can exercise, but you're able to talk. Vigorous exercise is such that you may find it a bit more difficult to talk because you'll be working so hard and you're struggling with your breathing. Before you start any exercise, make sure you speak with your doctors. I think that goes without saying, particularly if you have prostate cancer. If you are someone who wants to prevent prostate cancer, it's also equally important for you to do the same thing that reduces or increases the longevity of people who have prostate cancer. If you do it to prevent cancer, that works too. So you should aim at the minimum of 2.5 hours worth of exercise every week. And you can break that into sizable chunks. You can do 10 minutes in the morning, 10 minutes in the afternoon, 10 minutes at night. You don't have to do all the 30 minutes at one go if you don't have the time for it. But remember that 30 minutes a day is the minimum. The more you do, the better it is for you.
Excellent. Okay, thank you. Now, stress. Stress is such a huge word, and many things can provoke stress, or what's stress for one person might be something different to someone else. But how does it relate to cancer?
That's a fantastic question. Stress, or psychological stress, if I have to define it, is the feeling of being mentally, physically, emotionally strained as a consequence of various factors. It could be work, it could be your family, it could be your finances, and of course it can be due to serious ill health. Now, the relationship between chronic stress and cancer is complex, and we still yet to understand it fully. While it might seem logical to connect the two, this is part where we tread very carefully. This is because the studies are still struggling to connect the two in the same concept.
Okay, wow, that's intriguing. So can you break down the possible connections for our listeners?
Yeah, certainly. You see, stress, particularly chronic stress, and what I mean by chronic stress is stress that's been going on for a long time, can lead to unhealthy behaviors, things like smoking. We know that smoking is a risk factor for many cancers. I think smoking is the number one lifestyle choice that is associated with many, many diseases, including many, many cancers. We know that stress can cause overeating. We know that people who are stressed are more likely to drink alcohol and perhaps consume it in an excessive manner. So all of these things are known risk factors for cancer. So the connection might be indirect. So stress might lead individuals to engage in behaviors that then raises their risk of getting cancer.
I see where you're coming from. So it's not necessarily that stress directly causes cancer, but rather it might influence behaviors that can lead to it.
Precisely. It is crucial to differentiate between correlation and causation. Stress might correlate with the unhealthy behavior, but pinpointing it as a sole cause of cancer is a bit of a stretch.
That's an important clarification. Dr. Amobi, but what about those studies that suggest a link between stress and cancer?
The studies. Here's where things get interesting. Different studies have yielded various results. Take, for instance, there's a case control study they did in Canada, that hinted the potential association between work stress and the risk of prostate cancer. What is a case control study? A case control study is you have people who have the disease and people who don't, and then you ask them questions about their life and the workplace, etc. And then you try to determine whether people who live a particular lifestyle or people who have been through certain experiences at work, perhaps negatively, develop similar condition. So it's not the highest level of evidence. However, it's points us to the fact that there may be a potential association, but some other studies of similar kind as well that have said there's no link to it.
That is intriguing. So the evidence seems to be quite mixed.
Yeah.
Any studies that shed more light on this?
Yeah. So there is a meta-analysis. Meta-analysis, now this is a very, very high level of studies. So people will take, useful studies and then look into them and establish whether there's any correlation. So some studies, this is particularly in Europe. So it divided into so it looked at stress and see, is there a possibility that stress may be causing cancer? So they looked at 12 high quality studies to see if there's any relationship between work-related stress and risk of cancers like lung cancer, colorectal cancer, breast cancer, prostate cancer. And to everyone's surprise, there was no significant connection that was found. So, which is quite interesting.
Very. It's fascinating how the results can be so divergent. So what can we conclude from this, Dr. Amobi?
Well, that's a great question. So I think what we can conclude is that while chronic stress can certainly contribute to a wide range of health issues, things like cancer, its direct impact on the development of diseases still remain uncertain. I would say it's a complex puzzle with multiple pieces, and we're still figuring out how they all fit together.
Well, thank you for breaking it down. So in essence, more research is needed to fully understand the intricate relationship between stress and cancer.
Yeah, absolutely. I think the journey to uncovering this connection is ongoing. And as we gather more evidences, we'll probably get a bit more clearer picture on how, chronic stress and cancer manifests itself.
Thank you, Dr. Amobi, for guiding us through this complex topic. It's clear that while the stress-cancer link isn't straightforward, it's essential to continue exploring these connections.
Yeah, absolutely. My dad always said the more we learn, the more we're better equipped, and the more we are likely to make more informed decisions about certain things. So learning is a gradual progress. I'm sure someday we'll figure it out. But at the moment, the most important takeaway I would say is, stress impacts your life negatively. Just because it doesn't directly cause prostate cancer doesn't mean that stress is a good thing. It means that stress can lead you to behave or engage in lifestyles that can affect your health in the long run. So indirectly causing you diseases. So being mindful of your stress and dealing with it, talking about it, speaking with your doctor, all of these measures will be able to help you navigate this domain.
So moving on, now we're going to look at the relationship between prostate cancer and, alcohol consumption.
Yeah.
Okay, let's jump straight into that. Men statistically are more prone to excessive drinking compared to women. Can you tell us more about the implications of this? Men, high likelihood of excessive drinking. And, like in the US, there is an age restriction to alcohol. In the UK, there's equally an age restriction. And that goes to most of the European countries. What I'm unsure of, particularly, say, Africa, is whether individual countries in Africa as a continent actually have age restrictions to alcohol. The reason that, of course, there's a restriction on alcohol and advice in terms of how much you should take is the health consequences that comes with alcohol, which we will touch on as we go along. But we know that too much of everything is a bad thing. Mm-hmm. So, people who drink a lot of alcohol, higher risk of engaging in behaviors that, again, will affect their health. Chronic alcohol can cause chronic stress. It can lead to substance abuse. It can lead to various degrees of, sexually transmitted infections. A vast majority of people who were killed in the Western world as a consequence of alcohol, most driving offenses that leads to death are secondary to alcohol. Most people who are beaten to death or because the perpetrators are drinking alcohol, not all of them. So, but, so stress have very, very, serious consequences to your health and to both your biological health, psychological health, and your social health as well. So, yeah. Okay. That's a sobering reality. And when you say stress, you mean alcohol that can cause, obviously, stress and things like that. Speaking of the risk, we know alcohol is a major preventable risk factor for cancer. Can you elaborate on how this affects cancer risk, especially in men?
Absolutely. Alcohol has been linked with increases of various cancers, i.e. throat cancers, esophagus, your mouth cancers, colon cancer, liver cancers. And these cancers are much more common in men. Mm-hmm. And when it comes to prostate cancer, the debate has, raged on for years. So some rather comprehensive studies from various regions have shown correlation between moderate to heavy drinking and prostate cancer development. But to be fair, some observation studies have suggested that even some degree of wine consumption might have a protective effect. So we still haven't have a pinpoint understanding with prostate health particularly, but we know for the other type of cancers that I mentioned, the risk of increased alcohol use increases the risk of developing them.
Can you help us understand why the research on alcohol and prostate cancer has shown such mixed results?
Yeah, when I was looking at so many studies, and I looked at quite a lot of studies, and what many studies didn't consider other critical, other studies considered them critical. So there was some, say for example, things like diet. Some studies looked into people who are, with particular dietary intake. Most of those people don't have the same diet as the other ones. People who, including other studies, were smokers, whereas some other studies were not smokers. Some of them didn't look into family history. Some of them didn't look into sexual histories, and all of those things can influence prostate cancer. So is the type of questions A they asked, B is the type of control groups they had may not fit really, really well in extrapolating more concise answers. So we know that some people may misreport the amount of alcohol they actually consumed as well. So it's quite a difficult one to narrow down explicitly to say, yes, alcohol can directly cause prostate cancer.
So it's a puzzle with many pieces, each impacting the final picture. Mm-hmm. But how does the timeline of alcohol consumption play into this?
Yeah, okay. That's a good question. That's a very good one. Let me think for a second. So, prostate cancer grows very slowly. So the lifetime history of alcohol intake, is very important. So some studies, like I said earlier, haven't found any association between alcohol and prostate cancer, but they only looked at the drinking status, like how recently they're drinking. So, it is becoming clear though that if you drink a lot, too much, even Bible said it, too much of everything is not good. High alcohol intake, especially when people are binge drinking, like people drinking, then they get stupid drink, or they get drunk to stupor. It's linked to an increased risk of prostate cancer, irrespective of what type of alcohol that they've consumed. So we know that drink too much is terrible for you. So that's just the short answer for that.
Those are crucial points, Dr. Amobi. What about patients who are already dealing with prostate cancer?
What we do know is that alcohol can accelerate tumors growth, and it can, quicken the progression to more metastatic form of the cancer. So it is an important consideration, to be fair. So for those people who are diagnosed with prostate cancer, for me in clinic, I always say to them, alcohol run. Why? Because alcohol not only raises your risk of developing cancer in the first place, but its impact on its aggressiveness and the speed to which it progresses is extraordinary. So, you should be mindful that we're not saying that alcohol itself is the primary reason why people get metastatic cancer. And I think that's very important to make it very clear. But it interacts with other variables like poor diet, smoking, and all of those things. So for you to put alcohol in your mouth if you have prostate cancer, you have to ask yourself, what exactly am I going to gain from this? If it's not a lot, just leave it alone if you can. Now, if you want to and you can't, seek help from your doctor, from any alcohol anonymous in your country or within your locality.
It's clear, that the landscape of prostate cancer is complex with many factors at play. Are there any specific dietary patterns that can influence this risk?
So every time we speak here, we always talk about diet. And diet is a very, very important part of lifestyle. So I understand that geographic variations impact our dietary preferences a lot. In the UK, we normally reference the Mediterranean diet. the reason we reference a Mediterranean diet is because it's rich in vegetables, fruits, fish, nuts, olive oils, and there's some indication that it's associated, all these type of diets are associated with low prostate cancer risk. So I think this should be act as a reminder that what we eat is intricately tied to our health outcomes. Having said that as well, we need to remember that food is part of who we are in terms of our social status and social life. We eat with friends, we eat with families, so it's part of us. So we need to make it enjoyable, but every time that you want to eat something, again, like I said about the alcohol part, you need to ask yourself, this thing that I'm putting in my mouth, is it going to nourish my body or is it going to cause me more problem? And if you are at risk already, question is, why not increase your chances of survival or reduce your chance of the disease by eating food that is known or incorporating them? You don't have to change it just right away. You can start small and gradually and frequently, and then walk your way towards an aim.
Excellent. Fantastic insights. Just to conclude this point, what is the key takeaway for our listeners?
So I think the key takeaway is that alcohol and prostate cancer are connected to some capacity, particularly, but the connection is not straightforward. We know that exercise is tremendously important for your health. We know that what you eat is super important, because if you eat inflammatory food, which is like processed sugar on all of those bad stuff we talked about in the past, then those ones are not good for you. Stress, maintaining an environment where it's conducive for healthy living, reduce stress, super important. Sleep cannot be understated. Sleep is so important, not just for your prostate, for your heart, for your brain, for practically every part of your body. So if you put all of those measures in place, I'm sure that, you would be doing yourself a favor and justice, because at least you're giving your body the best option for survival.
Thank you, Dr. Amobi, for guiding us through this intricate topic. As always, your insights have been invaluable. Thank you again for tuning in to Medicine in Small Doses with Dr. Amobi. This concludes another episode. Always remember to stay informed and stay healthy. And to find out more information about what you've listened to today, please check out our website. And we always ask, if you did enjoy this episode, please remember to share it. Leave us a 5-star review on Apple Podcasts and like and comment wherever you can. Thank you again, and I'll see you in the next one.